Good morning. I'm Michael Harlovic, President and CEO of Oswego Health. Today is Friday, April 17th, 2020. With me today is Marq Brown, our Corporate Vice President of Human Resources. As you can see, Mark and I, we put our arms out. We're over 6 feet apart, so we're practicing social distancing. Our masks are clean and safely put in our bags. While we're walking around through the hospital and interacting with the public, we certainly have our masks on. What interesting times we're in right now, Mark. So if you take a look at it, I've been in healthcare myself for 35 years as a registered nurse, and I've seen other epidemics such as SARS, Ebola, the H1N1, but I don't think any of us has ever seen anything like the COVID-19 virus. Mark, would you say people are anxious?
I would say people are definitely anxious, yes.
Yeah, we can feel it. Mark and I wanted to take the time just to reassure you that Oswego Health is very well prepared in the crisis. I can tell you that 7 days a week, twice a day, we huddle to make sure that all of our PPE supplies are in place, to make sure that our staff are properly trained, to make sure any concern that anyone has is addressed. And this is a very evolving situation, but we really look to our physicians and other leaders to implement best practices. You know, there was a point in time early on where we weren't taking everybody's temperatures. We're taking everybody's temperatures now. Everybody is masked right now. I want to reinforce that if you're sick, come to the hospital. We're safer than we've ever been. And to give you a couple of examples. One big example is we now have a triage tent outside of the hospital. So when you come into the hospital, you're screened for any respiratory illnesses. And if you have any suspicious reason for potentially being a COVID-19 patient, we immediately implement our isolation protocols so that you can begin your treatment. And we keep, this helps us put all of our patients and employees in a very safe position. All of our other clinics are also still open. Our urgent centers are open. Of course, our emergency department's open. And we have telemedicine all throughout the organization. So if you feel uncomfortable or you're unable to leave your house, you can certainly call in and use our telemedicine applications that will work well through there. It's been difficult because we know that a few weeks ago we were in a position where, because we had to cancel our elective procedures, Mark, what percentage of our employees would you say that we had to furlough?
Approximately 25%.
Approximately 25% of our furlough. So we know that's a very difficult thing for all the people that are furloughed right now. But there's good news coming. So I was watching the news last night and I saw President Trump was saying that because the curve is flattening and we may have reached our peak, he's recommending a phased reopening of the economy. And he'll do that in conjunction with all the state governors, and in our case, it's Governor Cuomo. And right now, I can assure you that Oswego Health and the leadership here, and in collaboration with our board of directors, we are working on our reopening plan. So we're going to follow the state guidelines, the federal guidelines, and we will be right on top of this so we can get back up to full operations as soon as possible. Mark, if there are any questions, how would they reach you if people have questions?
We implemented a HR email address that people can email us at hr@oswegohealth.org that we'll be checking regularly and responding to those questions there.
We've also had enormous support from the community. I could probably spend the next 20 minutes thanking everyone. It's from the city and county governments all the way to individuals and letters of support, to the local schools, to the local restaurants, local pizzerias. They've sent us some food. In fact, just yesterday, the Oswego Police Department brought bagels in for some of our departments, which was a really great gesture. And they're always checking on us. We're always getting calls about what is it that we need. So in closing, I just really wanted to reinforce, we're open, we're ready for business, we're safe. We, in fact, are safer than we've ever been. We're growing and learning on a daily basis, and we really want you to choose, if you need care, please come to Oswego Health. Thank you. I'm Michael Harlovic, President and CEO of Oswego Health.
Stay safe and remember to social distance.